Welcome to our deep dive on HDHP versus EPO health plans. First, we will reframe how to think about premiums, copays, deductibles, and out-of-pocket maximums. Next, we will show why many people overpay for routine care while underinsuring the true financial risk. Finally, we will reveal the hidden power of HSAs and how to evaluate your options with confidence. Here is our roadmap. First, we will define HDHP and EPO in plain language. Then, we will expose the Copay Trap. After that, we will break down the HSA advantage. Next, we will focus on worst-case protection. Then, we will compare plans side by side and run examples. Afterward, we will give you a simple decision process. Finally, we will test your understanding with a short quiz. Before we start, please note this video is for education only and is not financial, tax, or medical advice. Plan features and costs vary widely by employer, insurer, state, and year. Always review your summary plan description and speak with your HR benefits team, broker, or a licensed advisor for guidance tailored to your situation. Let's define our terms. An HDHP is a high deductible health plan that qualifies you for a health savings account. This combination allows you to pay lower premiums and contribute to a tax-advantaged account. An EPO typically offers fixed copays for routine visits, which feels predictable but usually comes with higher premiums. The big question is whether you value predictable small-cost visits or maximum catastrophic protection with lower monthly costs and access to an HSA. The flowchart shows how your priorities direct you toward one plan or the other. Next, let's examine the Copay Trap. Fixed copays feel inexpensive for routine care, but you are essentially buying those discounts upfront with a higher monthly premium. For example, if an HDHP saves you $55 per month compared to an EPO, that is $660 per year. Contributing that amount to an HSA each year lets it grow tax-advantaged. Over time, the long-term value of these savings typically outweighs occasional copay discounts for visits. Now, to visualize where your money tends to go, this diagram contrasts spending emphasis under EPO and HDHP structures. EPOs typically allocate more to premiums and copays, front-loading costs for routine care. By contrast, HDHPs often redirect dollars away from premiums towards savings and investments via the HSA, while still keeping exposure to the out-of-pocket maximum. The goal is to highlight that the HDHP can convert what would have been sunk premium costs into tax-advantaged savings. Let's compare at a glance. On the left, the HDHP often offers lower premiums, HSA eligibility, and, in many cases, a lower out-of-pocket maximum, though you may pay more out-of-pocket before meeting the deductible. This combination tends to benefit both healthy individuals and risk-averse individuals focused on worst-case protection. On the right, the EPO provides predictable copays for routine visits, but typically requires higher premiums and often comes with a higher out-of-pocket maximum. It is simpler for frequent routine care, but can be weaker in worst-case financial protection. Now let's talk about the HSA, the secret weapon of the HDHP. It offers a triple tax advantage. Contributions can be pre-tax or tax-deductible, growth is tax-deferred, and withdrawals for qualified medical expenses are tax-free. The account is portable, rolls over year to year, and funds can be invested in mutual funds or similar vehicles. Even if your employer contributes nothing, consistent annual contributions and investment growth can snowball into a substantial healthcare and retirement reserve. To make the HSA practical, begin by building a small cash buffer to cover near-term expenses. Next, once you are comfortable, invest the surplus for long-term growth. Over the years, compounding can significantly increase the account value. Later, you can use the HSA strategically alongside retirement accounts, spending tax-free on qualified medical expenses. Here is a simple, illustrative example. The EPO premium is $450 per month, or $5,400 per year, with $30 and $60 copays, and an out-of-pocket maximum of $8,700. The HDHP premium is $395 per month, or $4,740 per year. Visits are subject to the deductible and coinsurance until you reach the out-of-pocket maximum, which in this example is $6,500. Only the HDHP is HSA eligible. Your actual numbers will vary, so verify your plan documents. Now let's prioritize what matters most in a bad health year. Always compare the out-of-pocket maximums first. Many HDHPs have lower out-of-pocket maximums than EPO plans, which means they cap your downside sooner. In a serious event, an emergency room visit, or a hospital admission, the premium you paid all year matters less than the speed at which you reach a lower ceiling. This is why worst-case protection can be stronger with many HDHPs. To decide, map your situation. If you are very healthy with low expected usage, the HDHP paired with steady HSA contributions often wins. If you have chronic, predictable monthly needs, an EPO's copays may be simpler. If you are risk-averse, begin your comparison with the out-of-pocket maximum, because it defines your worst-case exposure and often favors the HDHP. Here is how a worst-case year typically unfolds. You have an emergency room visit and admission. The provider submits claims to your insurer. First, the deductible applies by T. After meeting the deductible, coinsurance applies until you hit the out-of-pocket maximum. Once you reach that maximum, the insurer pays 100% of covered services for the remainder of the plan year. A lower out-of-pocket maximum means you reach full coverage sooner. Quiz time. Which three elements make the HSA triple tax-advantaged? Option A. Pre-tax contributions, tax-deferred growth, tax-free qualified withdrawals. Option B. Tax-free contributions, taxable growth, tax-free withdrawals. Option C. Post-tax contributions, tax-free growth, tax-free withdrawals. Option D. Pre-tax contributions, tax-free growth, taxable withdrawals. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is pre-tax contributions, tax-deferred growth, and tax-free withdrawals for qualified medical expenses. This combination is what makes the HSA uniquely powerful. Next question. For worst-case protection, which metric should you compare first between plans? Option A. Deductible. Option B. Specialist copay. Option C. Out-of-pocket maximum. Option D. Primary care copay. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is the out-of-pocket maximum. It is the true ceiling on your financial exposure during a bad health year, and often the most important number when comparing plans. Here is a quick selection process. First, gather your plan documents and note premiums, deductibles, out-of-pocket maximums, and copays. Second, calculate the monthly premium difference and annualize it. Third, confirm HSA eligibility and any employer contributions. Fourth, compare out-of-pocket maximums for worst-case years. Fifth, estimate your routine usage and price it under each plan. Sixth, run a disaster scenario and see which plan reaches the cap sooner. Seventh, consider tax effects of HSA contributions. Finally, decide. If you are healthy or risk-averse, the HDHP often wins. If you have high, fixed monthly needs, consider the EPO. Here are the key takeaways. Copays can be a trap when they require paying substantially higher premiums. The HSA provides unmatched triple tax advantages and long-term growth potential. For risk management, always start with the out-of-pocket maximum. HDHPs often provide stronger protection in catastrophic years while costing less monthly. EPOs may be better for those with high, fixed, frequent routine needs. To wrap up, if you are healthy or risk-averse, the HDHP paired with an HSA often wins over time. Worst-case years matter more than routine visits, so prioritize the out-of-pocket maximum. Finally, redirect saved premiums into an HSA to build tax-advantaged wealth. Thanks for watching. If this helped you, please like, share, and subscribe. Tell us in the comments which plan you chose, what numbers you compared, and what you want us to break down next.